Hello po mga ka-nursing, welcome back po sa ating channel, and for today's video, the focus of our discussion is about the body's acid-base imbalance. Before we continue po sa ating actual discussion, huwag pong kakalimutang mag-subscribe sa ating channel, paki-hit po ang notification bell para lagi po kayong updated sa mga next videos natin. So acid-base imbalance discussion is about the body's alkalinity and acidity. So the basic concepts that we need to know about the acid-base balance is that number one, it is measured by the pH. Okay? pH o yung tinatawag nating partial hydrogen ng ating dugo. So this will determine kung ang ating dugo ba ay acidic or alkalinic. Okay? And when we talk about acidity, we are referring to the presence of your acid substances that releases hydrogen. And ang kabaliktaran naman po niya is your bases or your alkalis wherein there is low hydrogen ion concentration in our blood. So yan po yung dapat nating tatandahan kasi later on, yung pH na yan, gamit natin para ma-determine natin kung acidic bang dugo ng isang tao or alkalinic ba. Okay. And when we talk about this one, we need to know how do acid and base balance is being regulated sa ating katawan. Paano po na-maintain yung state ng homeostasis in terms of the acid and base sa ating dugo. Okay? It is being regulated po, okay, by several organ systems sa ating katawan. But before we go to that, okay, we need to understand that our body fluids o yung mga dugo such as your plasma and other fluids in our body are slightly alkalinic. Okay, or slightly alkaline, which makes sense po. Kasi kung acidic po yan, okay, parang hydrochloric acid, and the lining of the different parts of our body is not the same with our stomach, pwede po niyan tunawin. Okay, that's why ang ating katawan po is, or the body fluids in our body is slightly alkalinic. And when we talk about the acidity and alkalinic measurements, sabi nga natin kanina, it is measured by your pH, and the normal pH of our blood is 7.35 to 7.45. Okay. So mataas po siya compare sa normal level ng hydrogen which is 7. Kasi nga ang ating dugo is slightly alkaline according to our book. And sabi ko kanina, it is being regulated by different system in our body. So these are regulated by the following. Number one is your respiratory. Okay, your respiratory system is responsible doon sa retention, okay, ng isang hydrogen ion sa katawan natin, which is your carbonic acid. Basically, your carbon dioxide. Alam naman natin na ang lungs natin ang nag-excrete, okay, ng carbon dioxide out from our lungs. Okay, siya po yung nag-determine kung gaano kadaming carbonic acid ang ilalabas ng ating katawan. And also, your renal system, your genitourinary system, ito naman po yung responsible sa retention and excretion of your bicarbonate. Okay, bicarbonate. So basically, ang ating respiratory system po is in your lungs. Of course, dyan po ang carbonic acid na babalance, and renal naman po, dyan naman po nababalance ang bicarbonate. Okay. And if in case po that there is an increased concentration of your carbonic acid or your bicarbonate, okay, tutulong po ang buffer system sa renal and respiratory system. Depende po kung ano din ang mataas. Kung yung ang mataas po ba is your carbonic acid, tutulungan niya si lungs. Kung ang mataas po is bicarbonate, tutulungan niya po si kidneys. So those are the regulatory organs or organ system of our body that is responsible in maintaining the acidity and alkalinity of our blood or body fluids. Okay. Now, for the interpretation po, we need to perform first a procedure, yung tinatawag nating ABG analysis. And before we can analyze the results, okay, we need to take first your samples. Okay. Samples will be taken, okay, sa ating artery. Kaya nga po siya tinawag na arterial blood gases. Basically, we are going to measure the concentration of arterial blood gases. So, arterial blood gases is used to evaluate the client's acid-base balance and concentration of oxygen in our blood. And this can be performed by several professionals such as of course, this is a main function of your respiratory therapies, but nurses, doctors, and even medical technologists can also perform the extraction of blood from the artery, okay, as long as they are trained to do so. And once you perform the procedure, okay, it is a must that we need to apply pressure to the puncture site for at least 5 minutes after the procedure. This is to reduce the risk of developing bleeding or bruising po sa ating puncture site. Okay, kasi nga po mataas ang pressure doon sa ating artery, okay, which is a blood vessel containing now your oxygenated blood. That is why we need really to apply pressure on that area kasi mas mataas ang hydrostatic pressure niya compared to the vein. Okay? So that is your ABG, and of course, once we already have the sample or the specimen for the analysis, it will be analyzed now. Okay, these are the normal ABG values or arterial blood gases values. So we have your pH, which is 7.35 to 7.45. Your partial oxygen, which is 80 to 100 millimeter mercury. Your partial carbon dioxide, which is 35 to 45 millimeter mercury. Your bicarbonate, which is 22 to 26 mEq per liter. Base excess is -2 to +2 mEq per liter, and oxygen saturation, which is 95 to 100%. Now, in interpreting your ABG, okay, ang dapat nating laging tandaan at wag nating kakalimutan, especially the normal values, is your pH, your partial carbon dioxide, and your bicarbonate. Because remember, the acidity and alkalinity of the blood will be determined by the level of pH. Kung siya ba ay less than 7.35 or higher than 7.45. Because between 7.35 and 7.45, that is a normal range. Okay? So, meaning that the patient is not acidic nor alkalinic. Okay? And of course, dalawa ang main organ na nagko-compensate niyan. Okay? Number 1 is your lungs. Okay? And number 2 is your kidney. Okay? And ano nga ba yung pinag-uusapan nating hydrogen ions na kailangang ilabas at i-retain ng katawan? So we have your carbon dioxide. Kaya minimeasure natin ang carbon dioxide. Okay? So this is related to your respiratory system. And your bicarbonate related now to your kidneys. Okay? So sila po kasi nag-determine ng alkalinity and acidity ng ating katawan, and because these two organs are the organs that is regulating yung acid-base balance ng ating katawan. Sir, anong pagkakaiba ng ating oxygen saturation sa ating partial oxygen? So ang partial oxygen po is the pressure of oxygen in the plasma, while your SpO2 or your oxygen saturation is more on the ratio of oxygen attached now to your hemoglobin, which is the oxygen carrier of the blood. Okay? So that is your normal ABG values. Again, you have to remember always yung ating partial hydrogen or your pH, partial carbon dioxide, and your bicarbonate. Okay. Now, in interpreting the data, these mnemonics actually help nurses, okay, and even doctors and other medical practitioners to interpret kung ang pasyente ba ay may respiratory or metabolic acidosis or alkalosis. Okay, so we are using yung tinatawag natin mnemonics na ROME. So what do we mean by ROME, sir? ROME is respiratory opposite, metabolic acidosis, or metabolic equal. Kasi pag pinag-usapan po natin is, if the data will be interpreted as respiratory, okay, lagi nating titignan si pH plus your partial carbon dioxide. And kailangan opposite po ang direction nila lagi. Okay, opposite ang kanilang value. Kung mababa si pH, dapat mataas si partial carbon dioxide for us to interpret the data as respiratory, either alkalosis or acidosis. Okay? At metabolic naman po siya, ang lagi nating titignan is si pH and your bicarbonate. Okay, sila naman po laging parehas ang direction ng values. Kung mababa si pH, dapat po mababa din si bicarbonate. Okay, mababa din si bicarbonate. That's the time we are going to make use of the metabolic to interpret the data. Para po mas maintindihan natin to, let's go to examples. Okay? Sabi natin kanina, interpreted data, I'm sorry for the typographical error. Interpreted data may be respiratory acidosis, respiratory alkalosis, metabolic acidosis, and your metabolic alkalosis. Okay? So these four can either be compensated or uncompensated. Ano naman pong ibig sabihin nun? Maidi-discuss natin yan sa ating mga next slides. Okay? Now, let's start first with your respiratory acidosis. Okay, from the word itself, respiratory, the lungs is actually compensating, and acidosis, acidic po ang pinag-uusapan natin. Okay, let's start first. Again, remember yung pH, partial carbon dioxide, and bicarbonate. Sila po yung ating basis for the interpretation. Number 1 is your pH. Okay, pH, sabihin natin yung respiratory acidosis kung ang ating pH is less than 7.35. Should be arrowed down. Okay, makakatulong po ito nagawin nyo pag kayo po ay nagtitake ng exams or even interpreting the data. Magmark po kayo ng arrow para mas makita nyo yung direction ng ating data. Okay, so pH is less than 7.35 indicating acidosis. Again, respiratory, anong kailangan nating tignan? Tignan natin si partial carbon dioxide. Ano dapat ang direction niya? It has to be opposite with the pH. Kung less than 7.35, dapat ang ating partial carbon dioxide is more than 45 kasi ang ating value is 35 to 45 millimeter mercury. So 35 to 45 millimeter mercury. For us to interpret this as respiratory acidosis, partial carbon dioxide should be higher than 45 millimeter mercury. Meaning, there is an excess carbon dioxide that is related now to increased concentration of carbonic acid sa ating katawan. Okay? And your bicarbonate. So, your bicarbonate, ano naman ang kinalaman niya, sir, sa interpretation ng respiratory acidosis? This will now determine kung compensated ba or uncompensated yung ating condition. Okay? Compensated po siya. Okay? Compensated po siya kung ang value ng ating bicarbonate is normal or equal. Okay? Equal doon sa normal range, which is 22 to 26. However, kapag siya po ay umangat or tumaas na more than 26 megs per liter, okay, we are going to interpret this as respiratory acidosis compensated. Pero, kapag normal naman po yung values, respiratory acidosis uncompensated. Okay? Sana po malinaw tayo doon. Again, respiratory opposite. So, respiratory acidosis, pH is low, partial carbon dioxide is high, bicarbonate is either normal or higher than normal. If it's normal, that is uncompensated, but if it's higher, that is compensated. Sana po malinaw tayo doon mga ka-nursing ha. Okay guys, so after po ng respiratory acidosis, ang next naman po na i-interpret natin is your respiratory alkalosis. So respiratory alkalosis, ganun pa rin po. We have to look at the 3 ABG results. Okay? Number 1 is your pH, followed by your partial carbon dioxide and your bicarbonate. Since ang interpretation natin is still more on respiratory, we have to focus on 2 interpreted data or the analysis of the 2 ABG data. Number 1 is your pH and followed by your partial carbon dioxide. Again, respiratory po tayo. So, yun po yung ating focus. And alkalosis, so expect po natin na the pH should be higher than normal. So, it should be higher than 7.45. Okay? Huwag po natin ulit kalimutan maglagay ng arrow po. So, the arrow will guide us para makita natin kung opposite ba sila or equal yung direction ng ating data related now to your respiratory conditions or respiratory acid-base balance. Sabi nga natin kanina, yung relation ng pH sa ating partial carbon dioxide. So let's take a look at the result of your partial carbon dioxide. Since mataas po ang pH natin and the interpreted data is respiratory alkalosis, we would expect that the partial carbon dioxide will be lower. Okay, lower than the normal value, which is your less than 35 millimeter mercury, indicating that there is an inadequate carbon dioxide or related now to inadequate carbonic acid sa ating katawan. Okay, so nagkakaroon tayo ng problema in terms of excretion. Okay, in terms of retention of normal acidity or normal carbon dioxide dapat meron sa ating katawan. Okay. And of course, the third data that we need to analyze is your bicarbonate. Okay, again, don't forget the arrow po. Kalimutan natin. Okay, again, the third data is the bicarbonate. This will now determine if the body is compensating or not compensating. Okay, so compensating or not compensating. Kapag ang value naman po ng ating bicarbonate is normal, so meaning equal po, that will be interpreted as uncompensated. And if it's more than, okay, or less than, less than 22 mec per liter, that will indicate now your compensated naman po. Compensated. So kung makikita nyo yung pagkakaiba kanina doon sa ating respiratory acidosis and alkalosis, of course, pagkaiba po sila ng direction in terms of pH. Lower po ang acidosis while higher naman po ang pH ng alkalosis. Okay? Yung partial carbon dioxide is of course the opposite. Kung kanina sa ating acidosis, acidosis, partial carbon dioxide is higher, dito naman po is lower. And ang bicarbonate naman po is opposite din po ng ating bicarbonate kanina sa ating acidosis, which is lower naman po ngayon compared sa kanina, which is higher than 26. So we will interpret the data as respiratory alkalosis, either compensated or uncompensated. So, uncompensated kapag normal ang bicarbonate. Compensated naman po pag below normal ang ating bicarbonate. Okay. So, that is your respiratory alkalosis. Okay. The third interpretation naman po natin or the third interpreted data is your metabolic acidosis. Again, metabolic, balikan po natin yung ating mnemonics. Rome, respiratory opposite, metabolic equal naman po. Equal. So, ano yung dalawang equal na yun, sir? Kailangan nating tandaan pa din yung tatlong data of your ABG results, which is your pH, okay, followed by your partial carbon dioxide and your bicarbonate. Pero dito naman po, ang focus natin is your pH and bicarbonate. Your partial carbon dioxide will be the one naman po to determine kung nagko-compensate ba yung ating lungs o hindi. Okay, due to the acidity of the body or alkalinity of the body. So, para po mas maintindihan natin, let's go with figures. So, again, pH must be less than 7.35 to interpret it as acidosis. We are not yet sure kung ang ating first word ba is respiratory or metabolic. So, ang dapat tignan natin lagi is si partial carbon dioxide and your bicarbonate. Okay? Focus tayo. Ngayon, sa ating partial carbon dioxide, so normal, kung ang interpretation is normal or less than 35. Okay, millimeter mercury. As you can see, yung arrow po nila is either equal or parehas na pababa. Okay. Kasi kung nag-opposite po itong dalawa, kung nag-opposite po sila, ang ating first word ng interpretation is respiratory. But since equal po sila, more or less the first word is metabolic by nature. Depende po yan kung higher or lower po ang ating bicarbonate. Sir, paano naman po kapag nag-equal silang dalawa? Pati yung ating bicarbonate naman po is, imbis na equal, nag-opposite. Okay, that is an example of an error interpretation. Tendency po, baka ulitin po yung ating ABG analysis o yung pag-interpret or pag-extract po ulit ng ating dugo sa ating artery, then to check again the results of the ABG gases. Okay? Again, let's go back to the topic, metabolic acidosis. So, ang focus natin is si pH and the bicarbonate. So, the bicarbonate should be equal, okay, doon sa direction ng level ng ating pH. So, okay, so bicarbonate is less than 22 mEq per liter. Okay, inadequate bicarbonate naman po ang nangyayari. So, kung nakita mo na po yan, parehas sila ng direction, acidosis, dapat mababa din ang bicarbonate para masawag natin siyang metabolic acidosis. Okay? Then, titignan natin si partial carbon dioxide kapag within normal range, that is uncompensated. But if it's less than 35, that is compensated. Okay? Sana po malinaw tayo dyan. And the last one is your metabolic alkalosis. Metabolic alkalosis, again, look at the pH, partial carbon dioxide, and your bicarbonate. But since metabolic po ang gusto nating tignan ngayon, the focus will be the arrow for the pH or the level of pH and bicarbonate. Okay? So, alkalosis po ito, more or less ang ating pH is gonna be higher than the normal, which is greater than 7.45. Okay? And your partial carbon dioxide, okay? So, parehas din po sila ng arrow. So, dapat mas mataas siya sa 45 mm mercury. Okay? Or normal. Okay? Kapag normal po siya, that is uncompensated. At pag above the normal, that is compensated. Okay? And the last one is your bicarbonate. Yan. So, bicarbonate is gonna be greater than 26 mEq per liter. Ibig sabihin, there is an excess bicarbonate. As you can see, parehas po sila. It has to be parehas. Sorry for the arrow. So, dapat po up yan. Up. I'm sorry. Erase yan. Erase. Okay. Up. Dapat po siya. Up. So, up and up. So, that is your metabolic. Since higher than your 7.45. Next word is alkalosis. Determine natin siya kung siya ay compensated or uncompensated, depende kung ang partial carbon dioxide is normal or greater than 45 mm mercury. Again, arrow up, alkalosis. Sorry for the wrong arrow po here. Okay? So, it's greater than 26 mEq per liter. Okay? I hope clear po tayo sa mga interpretations na yan. And before we end our discussion for today, I have 4 questions here na pwede po nating pag-practicean to interpret the data. You can comment your answers sa ating comment section or pwede naman sagutan yon on your own. Okay? Kasi bibigay din naman natin yung sagot natin at the end. Okay? So, let's start with this one. Okay? Let's practice. Let's practice po. Okay? For number 1. So, what if the pH of the patient is 7.32? Okay? Ang kanyang partial carbon dioxide is 48 mm mercury. Okay? And ang kanyang bicarbonate is 24 mEq per liter. Tandaan po natin si Rome, respiratory opposite, okay, metabolic equal. So, the first thing we have to do is check muna natin ang values. Kung mas mataas ba sa normal, mas mababa sa normal, or nasa normal range. Let's start with pH, 7.32. So, lower po siya. Okay, lower. So, meaning, ang ating second word is automatic ng acidic. Okay, let's find out kung ano ang ating first word. Okay, let's find out kung ano ang ating first word. Partial carbon dioxide, is it normal or no? Okay, so that is above the normal range or above 45 mm mercury. And bicarbonate is equal. So, tignan natin, Rome, saan ba siya applicable? Sa respiratory opposite po ba? Or sa ating metabolic equal? Tignan natin, acidic na po yan, acidic. Okay? So, meron tayong opposite dito. Kasi ito yung respiratory system. This is more on metabolism. Metabolism. So, normal naman po ito. So, more or less, the answer is gonna be, okay, the answer is gonna be acidosis po tayo. So, that's your respiratory acidosis. Okay. Tignan natin kung compensated or uncompensated. Since normal po ang value nito, okay, normal, so the answer is uncompensated. Okay, uncompensated. Okay. Another question here. Let's practice again. pH. Okay, pH is 7.47. Tignan natin ang arrow. Okay, later on, let's put an arrow. Partial carbon dioxide is 42 millimeter mercury and bicarbonate is 28 mec per liter. Let's put the arrow. pH is greater than normal. Partial carbon dioxide is within the normal range and the bicarbonate is above the normal. So, respiratory opposite, metabolic equal. So, tignan natin sa respiratory, pH and respiratory. So, hindi natin siya ma-interpret as respiratory. Tignan natin si pH to bicarbonate, equal ba sila? So, the first word is metabolic. So, since this is higher than normal, that is alkalosis. Okay, alkalosis. So, we have your metabolic alkalosis. Check natin kung compensated or uncompensated. So, tignan natin, normal value ba siya? Yes, pag normal value, it will be interpreted as uncompensated. Uncompensated. Sana po malinaw tayo dyan. Let's have another example po. Okay. So, what if the pH is 7.29? Okay. Partial carbon dioxide is 32 millimeter mercury. Your bicarbonate is 20 mec per liter. Okay. Let's put the arrow. So, ang ating pH is mababa. Ang ating carbon dioxide is mababa. Okay. And ang ating bicarbonate is mababa. So, respiratory equal. Pasok po ba sa respiratory interpretation? Okay. Respiratory is equal? No. Kasi dapat opposite sila. Kamusta ang pH in relation to bicarbonate? Equal ba sila? Or parehas ba ng direction? Yes. So, metabolic equal. So, the first word is metabolic. Okay. Second word natin is acidosis. Okay, acidosis. Kasi less than 7.35. Okay, tignan natin kung compensatory or uncompensatory. Ang normal range ng partial carbon dioxide is 35 to 45 millimeter mercury. So this is obviously lower. So that is compensated. So we have your metabolic acidosis compensated. Okay, another example po. Another example. Okay, last po. Sana po nakukuha natin yung example natin. Okay, last. pH is 7.33. Partial carbon dioxide is 47. Bicarbonate is 27 mec per liter. What is the interpretation? Let's put an arrow. Arrow down for pH kasi lower than 7.35. Arrow up for partial carbon dioxide kasi mas mataas siya sa 45. Bicarbonate is up kasi nga po, okay, kasi nga po ang normal natin is 22 to 26. So with this interpretation, ano ang sagot natin? The answer is your, okay, so automatic po, 7.35 is acid. Okay, respiratory opposite po ba sila? Yes. So, second word is respiratory. First word is respiratory. So, compensated or uncompensated? So, normal po ba ito? No. So, siya po ay compensated. Okay. So, that is your interpretation of your ABG analysis. Okay. I hope that you have learned something from us today po. And please don't forget to subscribe to our channel. Hit the notification bell and pa-like and share na rin po ng ating video. See you po sa mga susunod nating video and happy nursing po sa ating lahat. Bye for now.